A club of people who know the devastation when a doctor comes in the room and tells the person that you love that they have a debilitating disease without a cure or any treatment to slow down progression. Diseases like ALS, Alzheimer's, Parkinson's, Huntington's disease. A club of people who miss their loved ones very much. It's fitting that this past Sunday, June 2nd, was Lou Gehrig Day, a day that celebrates when the Iron Horse, as he was known, became the starting first baseman for the New York Yankees. Ironically, June 2nd is also the day in 1941 that he passed away from ALS at the age of 37. And sadly, Lou Gehrig's prognosis would be largely the same if he were diagnosed today, 83 years later. But in his well-known farewell speech, where he told a packed Yankee Stadium that he felt like the luckiest man on the face of the earth, he also said that even though I've been given a bad break, I've got an awful lot to live for. I'm realizing more and more it's often those things that break your heart that can also give you hope, that can give you purpose. So today I'm proud to announce bipartisan legislation, along with many of my colleagues and friends, a number of whom I'm so honored to have join us here today, and my friend, House Republican leader Brian Cutler, who knows that same heartbreak, having lost both of his parents to ALS. Bipartisan legislation that would create the Pennsylvania Neurodegenerative Disease Research Program. It would make $10 million of grant funding available to the world-class teams of researchers at institutions across the state of Pennsylvania. Right now, the research being done on these diseases is largely dependent on federal dollars, which is limited and exceptionally competitive. In talking with the various research specialists, I'm convinced of the impact a state investment like this one would have. Early on in his battle, my dad was accepted into a clinical trial. And although the drug proved to be ineffective, I had such hope then. And I never lost that hope. The hope that we're just one breakthrough away from unlocking the mysteries behind these cruel diseases that rob our loved ones of their cognitive or physical abilities. Just one breakthrough away from making these chronic and livable diseases. One day, one breakthrough away from a cure. I'll end with a story of hope. One of my closest friends was diagnosed with leukemia in her early 20s. They put it into remission, and it came back. They gave her a bone marrow transplant, and then it came back. So with her third bout of leukemia, doctors said, there's nothing more we can do for you, and you should get your affairs in order. Imagine being told that at any age, let alone your late 20s. But in the nick of time, she received a call from MD Anderson in Houston, Texas, and said, we think you would fit or qualify into a clinical trial with this groundbreaking immunotherapy. She was accepted, and it worked, and it saved her life. And I think about that whenever I get to be with her. Science and medicine caught up to save her life. So I could think of no more noble of a cause, no greater purpose than to give people hope, to give research experts the tools they need to develop better treatments and cures, and to save lives. And with this group, with this club, with our shared purpose, I can think of no better time and place to start. So I thank you so much for being here and for supporting me. And I'd like to introduce Representative Valerie Gatos, who I know has a very personal story to share as well. And I'm grateful to her for being here.
Thank you, Representative Mullins, and thank you for everyone here who is supporting this initiative. My mother had Parkinson's disease. She went from an extremely vibrant individual, active in the community, always was there watching our sports games after school, baking cookies for the team. She ran her own retail shop. She was active, and suddenly getting that diagnosis of Parkinson's when we saw that she started to slow down, starts with tremors, and proceeds into slow movement, stiffness, loss of balance. The loss of balance was just absolutely devastating to watch somebody go through that. There are 6 million people that are affected by Parkinson's every year, and this is something that is absolutely needed to research these diseases. And this is 6 million just with Parkinson's, not the others, other neurodegenerative diseases. My mother was one of the initial people who was one of the first 100 individuals who got DBS, deep brain stimulation. And I remember watching her when she was so committed to doing that because she really wanted to advance research, be the first to help others. And that's what she said, she wanted to help others. So she had the deep brain stimulation surgery done. It was very helpful in terms of reducing tremor, did not help balance, but it really did change her life and extended it for quite a while. She passed away in 2017, and she donated her brain to the brain bank so that they can proceed to look at those tissues to see and advance research, because that was something that was really important for her, because she felt she did not want to have her Parkinson's go without helping others. And this is why this is really important for me, is that I think that this will help millions and millions of people. We have to put the money into research on this, and I'm very thankful to my colleagues who are putting this initiative forward, and I believe that we need to move forward with this. Thank you. Oh, yes. I'm sorry. And I'd like to introduce next is Dr. Zachary Simmons. He's with the Penn State Hershey Medical Center. Thank you.
Nice job. Thank you very much. Elected officials, other distinguished guests, my name is Dr. Zachary Simmons. I'm a neurologist with a special interest and expertise in ALS, also known as Lou Gehrig's disease. I direct the ALS Clinic and the ALS Research Center at Penn State Health, Milton S. Hershey Medical Center, where I've had the privilege of participating in the care of people with ALS for more than 30 years. I wish to emphasize today that I'm not speaking for myself alone. Colleagues from Jefferson University and the University of Pittsburgh have been essential in working with myself and others at our institution in providing input to Representative Mullins. However, we represent only a part of the enormous amount of research on neurodegenerative disorders occurring at academic institutions statewide. ALS is a devastating disease, as you've already heard, leading to death within 5 years in 80% of individuals so affected. Giving this diagnosis to a patient is one of the most difficult things I do, and inevitably, it's a shock to the recipient. With the essential collaboration of nurses, therapists, social workers, mental health professionals, and others, physicians do all they can to optimize quality of life and to prolong survival in these individuals. However, I'm sure I'm not alone when I say that I wish we could do more, and that's where research comes into the picture. One message that has come across loud and clear over the years from our patients and from their loved ones is for the need for ever more research into the causes and potential treatments for ALS and other neurodegenerative disorders. Now, the term neurodegenerative disorders is a mouthful. It includes Alzheimer's disease and other dementias, Parkinson's disease, and related movement disorders, as well as many other diseases. And what's often underappreciated is the overlap between these disorders. For example, patients with ALS may develop dementia. Those with Parkinson's disease may have features of ALS. And some patients have a neurodegenerative disorder that defies a clear disease-specific classification. I frequently reach out to my colleagues in other fields to see such patients after I've evaluated them so we can put our collective heads together to optimize diagnosis and care. My clinical colleagues and I work closely with scientists who are the ones responsible for the cutting-edge research that this proposed bill would support. The reason that treatments for these disorders are limited centers around our limited knowledge of their causes. So I'm so often asked by patients and their families, why did I get this condition? Usually I cannot answer that question. I'm also often asked, if you can't cure this, can you at least stop it from getting worse? The answer, unfortunately, is that we can do some things to alter the natural history, but currently we cannot prevent the eventual progression of these disorders. Patients and family ask me why we do not have better treatments for these disorders so long after Lou Gehrig died of ALS. This is largely a result of their complexity and the complexity of the brain and the nervous system. In order to develop more effective treatments, a better understanding of these underlying mechanisms is needed. It takes major initiatives to make these strides. Scientists in a variety of different fields working with clinicians who understand the impact that these conditions have on patients. This funding is not to initiate research in these fields from scratch. We're fortunate in Pennsylvania to have senior physicians and scientists at a variety of large research institutions who are working hard to make the necessary advances. We could do so much more with a statewide collaborative initiative that would permit sharing of ideas, reduction of duplication, and participation of patients throughout the state. For it is efforts that our patients selflessly make, whether donating blood samples, completing complex questionnaires, or giving the ultimate donation of brain and spinal cord tissue after death, that goes so far in permitting us to broaden our knowledge and identify better treatment mechanisms. We're all smarter and more productive when working together. More research and better collaboration are at the heart of this proposed legislation, and I'm thrilled that we live in a state in which this has the potential to become reality. My sincere thanks go to Representative Mullins for spearheading this. My gratitude goes to our patients and families who have shared their lives with me and taught me much. Thank you all for being here today in support of this effort. Now I'd like to introduce, Frances Gibbons of the Alzheimer's Association.
Good morning, and thank you for the opportunity to join all of you today, and thank you to Representative Mullins for bringing this group of organizations, individuals together for such an important reason. My name is Frances Gibbons. I'm the Senior Director of Development for the Alzheimer's Association Greater Pennsylvania Chapter. Alzheimer's is a devastating disease impacting millions of families and our nation's economy. The only way to change this is through research and funding organizations working day to day with local communities and families in need. This includes over 800,000 people living here in Pennsylvania who are either living with the disease or providing care to a loved one with Alzheimer's diagnosis. These Pennsylvanians are one of the many reasons why the Alzheimer's Association is leading the way to increase Alzheimer's research funding at a federal and state level. At the federal level, we have propelled the government through our advocacy efforts to rise to the challenge of meeting Alzheimer's research needs, resulting in more than sevenfold increase in federal Alzheimer's and dementia research funding since 2011. Today, Alzheimer's and dementia research funding at the National Institute of Health is $3.8 billion annually that has directly benefited Pennsylvania's, as we have 2 Alzheimer's disease research centers in our Commonwealth, one at the University of Pittsburgh and the other at the University of Pennsylvania. As the world's largest nonprofit funder for research, the Alzheimer's Association currently has more than $405 million invested in active projects across the world in 56 countries. Right here in Pennsylvania, we are currently funding 33 active grants totaling over $6 million at institutes like Pitt, Penn State, Penn, Jefferson, and more. At these sites, along with the world-class research institutes right here in Pennsylvania, scientists are able to work at more rapid pace to advance basic disease knowledge, explore ways to reduce risk, uncover new biomarkers for early diagnosis and drug targeting, and develop potential treatments. I've seen firsthand all of the great work being done here locally and nationwide due to the direct funding of Alzheimer's research. While this is tremendous strides we have seen over the years and has been impressive, we know that it's not enough. Alzheimer's is a fatal disease that has no cure. I encourage the state of Pennsylvania to join us in the fight to end Alzheimer's disease as a related dementia, as both as the senior leader of the Alzheimer's Association here in Pennsylvania, as well as a private citizen and caregiver for my father who's living with Parkinson-related dementia. It will be 10 years this August when my father, who resides now with me, was diagnosed with these overlapping debilitating diseases. I have seen firsthand how this disease has changed my father's personality, taken over his precious memories, and affected his daily life. At the time of my father's diagnosis, there was no treatment. A diagnosis took over 6 months of daily advocating for my father, daily advocating. In the past 8 years, I have been with the Alzheimer's Association. We have made amazing strides, which would have been extremely beneficial to our family. However, there's so much more that can be done. Proactively working to build on the federal and private funding available to speed research and its implementation is an important step, and I hope that we can join the force. Thank you. Next will be Julia Pitcher, Michael J. Fox Foundation.
Thank you, Francis. And thank you to all of you who are here today. Good morning. My name is Julia Pitcher, and I head state government relations for the Michael J. Fox Foundation for Parkinson's Research. I'd like to thank Representative Mullins, as well as everyone here today in the light and the need of collaboration and teamwork in shedding light on the critical need for research in the neurodegenerative space. For 24 years, the Michael J. Fox Foundation has functioned with a singular goal in mind: to end Parkinson's disease. To date, the foundation has funded nearly $2 billion in research programs worldwide, working to ensure that the development of improved therapies for those living with Parkinson's today. And I am so pleased to highlight this legislative initiative that will positively impact the Parkinson's community and together in the neurodegenerative space. The first provision directs the Department of Health to develop this plan to that affect healthcare conditions affecting the brain, specifically those with a terminal or progressive disease status, such as Parkinson's. Not only will this plan support Parkinson's research and transformation, it will move the needle for neurological conditions such as ALS and Alzheimer's, with the potential to benefit so many people and families in this state, but also globally. As tens of thousands of Pennsylvania residents live with a neurological condition, it's crucial for state governments to bring relevant stakeholders together to map out specific plans to support individuals, families, and caregivers, but most of all, the research that will end up finding better prevention and ultimately a cure. At the foundation, we applaud the General Assembly for taking these necessary steps here in Pennsylvania. This powerful tool will provide the research community with invaluable data to fuel more studies in the disease space that can lead to further breakthroughs in treatments and therapeutics. But there is so much more that needs to be done to support the community. In addition to this effort, there is also another bill within the General Assembly, House Bill 1754, that will expand insurance coverage requirements for biomarker testing. That is the analysis of somebody's tissue, blood, and other substances, known as biomarkers, that can provide information about the disease. Last spring, the foundation announced the discovery and the validation of the first ever Parkinson's biomarker through the Parkinson's Progression Markers Initiative, otherwise known as PPMI, a landmark clinical study with sites around the globe, including here in Pennsylvania at the University of Pittsburgh and University of Pennsylvania. The critical research breakthrough promises a future where every person living with Parkinson's can expect improved care and treatments, and the newly diagnosed individuals may never have to live and advance to full-blown symptoms. While we're encouraged by this incredible progress in our Parkinson's research, we are also reminded that resources to support these initiatives are now needed more than ever. The Foundation looks forward to continuing to partner with our lawmakers to seek opportunities to accelerate improved care and to support our ultimate goal, a cure. There is without a doubt a sense of urgency for action. Parkinson's disease is now the second most common and fastest growing neurological condition worldwide after Alzheimer's. An estimated of more than 1 million individuals are currently living with the disease in the United States, and as Representative Gato said, around 6 million around the world, with around 90,000 new diagnoses added to that number every single year. Here in Pennsylvania, we estimate that there are more than 50,000 residents living with Parkinson's, which results in direct and indirect costs of approximately $2.5 billion each year to the state. Now is the time to put a spotlight on Parkinson's, those who live with and care for people living with this disease every day, along together with other neurodegenerative diseases. I'd like to commend our incredibly resilient community, patients, caretakers, advocates who inspire us every day to fulfill the Foundation's mission to find a cure, and together we can change lives. Thank you all so much for being here. And I'd like to introduce Tony Hill with the ALS Mid-Atlantic Association. Thank you.
Thank you very much, and thank you to everyone here today. My name is Tony Heil with ALS United Mid-Atlantic. We serve people with ALS in Pennsylvania, New Jersey, and Delaware, and have been supporting our family since 1977. This initiative is obviously personal to all of us, but it's particularly personal to me. I lost my grandfather to ALS in 2007 and my grandmother to Parkinson's disease in 2009. Like the representative, my grandmother had deep brain stimulation, which gives me great hope for what we can do with other research into ALS and Alzheimer's as well. My family knows firsthand how terrible these diseases are, but I know that there's a significant hope because of the exceptional research programs right here in Pennsylvania. This neurodegenerative disease research initiative proposed by Representative Mullins will be a breakthrough for science and research. Scientists continue to find ways to effectively collaborate across the Commonwealth, and this program will enhance that collaboration and accelerate new breakthroughs in search of treatments and cures for these diseases. Pennsylvania is home to some of the top scientific research centers in the entire country, with leaders from institutions like Penn State Health Hershey Medical Center, the Jefferson Weinberg ALS Center, UPMC in Pittsburgh, and other nationally and internationally recognized programs that are all working together with the goals of finding treatments for diseases like ALS, Parkinson's, and Alzheimer's disease. This program announced here today is a bold initiative that will harness the power of these brilliant researchers and show that Pennsylvania is the leader in brain research. In addition to advancing underfunded programs, this initiative will help today's leaders train the next generation of researchers, attract and retain jobs in science and medicine, and provide an opportunity to leverage our knowledge to bring in more national programs and research projects. I'm proud to stand here today with this amazing organization and with individuals who understand these diseases so well, like my friend Kelly Rose, who lost her beloved husband Wes, who is so dear to so many of us, Paul and Eileen Miller, and Mark and Lori Shefsky, who are here today. And I want to introduce Mark so he can tell you why this is so personal to him and why the legislature should pass this legislation. So Mark, please, if you want to speak quickly about your look.
Am I gonna be heard you on this? You hear me? Yeah. So my name is Mark Shefsky. I am currently living with ALS, if that wasn't obvious. Now, we're advocates for a cure of all these diseases. Pennsylvania can and should be a leader in brain research. Together we can do this.
We have the power to make real progress. Please join us to support this critical program.
Thank you.
Okay, thank you everyone for sharing your talents and your heart and your time with us today. I'm grateful. Before I open it up to questions from the press, I would just like to recognize my colleagues who have made time to come here today and whose support I'm grateful for. Representative Mary Jo Daly, Representative Pat Gallagher, Representative Kyle Donahue, Representative Missy Serrato. You heard from Representative Valerie Gatos, and Senator Brown, Rosemary Brown, was here just earlier and had to leave. So I'd be happy to open it up for any questions. That's a first, and I'm okay with it. But in closing, I think it's just important again to reiterate that it is those things that break your heart. It's those things that break your heart that can give you hope and that can give you purpose. And I am increasingly hopeful and feeling such purpose here today. And I'm just grateful to be here and to be working on something so important with so many friends. So thank you again.